Hello, and welcome to Community Pulse, a CAN TV program featuring local leaders and organizations focused on improving the health and well-being of the city of Chicago. Community Pulse is presented by the Foxglove Alliance, a public health coalition supported by the Hectone Institute of Medicine in partnership with the Healthcare Council of Chicago, managed by Third Horizon, and Hectone's Nurses and Humanities. My name is Meghan Phillipp, and I am one of Community Pulse's rotating hosts from HC3, the Healthcare Council of Chicago. And joining me today is one of my other rotating co-hosts, Levi Moore from the Hectone Institute Foxglove Alliance. So welcome, Levi.
Hello. We don't normally appear on camera together.
I was going to say, and unfortunately, we were supposed to be joined by our third wheel, but Takora had a personal reason to not join us today. So we send our best to Takora as we wrap up 2024. So, Levi, it's been a very exciting year. So let's talk about, first of all, this is our second year hosting Community Pulse. In our partnership with our different organizations. So why don't you share a little bit about your organization and how we all started this 2 years ago and what your vision was and if we're fulfilling that vision.
Yeah. I've been affiliated with CAN TV for a decade easily. And I was on the board and then I was chairman. And I used to do a show and hadn't done one in quite a while, so I said, you know what, I'm now in this public healthcare space, so it makes sense that we could do a show on public health in Chicago. And so the idea sprouted, I was like, no, I can't do this by myself, so let me go and try to find some people to assist. And Meghan, I probably talked to you more than anybody I've actually talked to at Hectone. We're always at the same events and on the phone a lot. And then the Nurses and Humanities. And let me tell you about them. They're really interesting. They've always been a part of Hectone. And there are roughly about 115 members. But about a year and a half ago, they got this new designation. They are the Chicago chapter of the Academy of Medical Surgical Nurses, and that is a national association with about 10,000 members, and their goal is to recruit more women and men, emphasizing men, into nursing, but then to also help nurses with career development and even personal development. A big reason why they did the humanities program is to provide them with, a creative outlook, almost sort of like art therapy type activities. So they've really been great partners, and so the Foxglove Alliance, which I'm the coordinator of, and HC3 is a member, but some of the work that we're involved in, our priorities, initiatives, it hit me that, hold it, the Academy of Medical Surgical Nurses is a perfect potential member to help with the Youth Pathways work. So that's how this all came together, and I think it works out well because Takora has a different view from healthcare as a practicing nurse, as opposed to me, who sort of just kind of elbowed my way into public health about 8 years ago. So I think we have a good rotation of different types of guests, and I know that the shows I did this year, they really kind of reflected more on, things I was involved in through Foxglove.
Yeah. So as Levi so graciously outlined, it's our three different convening groups that really kind of develop these programs. And I really appreciate the very deep-rooted public health focus that both Foxglove does with public health convening, but also the intersectionality of the nurses and humanities piece and the development that Takora has brought. Uh-huh. And where I sit with HC3, we convene both business and provider stakeholders across the spectrum to really drive activities around health equity in Chicago. So hopefully what we are achieving is this intersectional approach to elevating the issues that happen within our communities through this program. So, Levi, tell us a little bit more about some of the partners that you were able to talk to this year.
Well, yeah, Fox Glove Alliance has two kind of big initiatives right now. One is the Foxglove Innovation Initiative, and then we've been working on really for like the last 3 years, the More Minorities in Medical Research campaign, M3R. And there's two components to that. To get more black and brown people in Chicago to participate in clinical trials, and then to get more black and brown youth to enter into careers in public health, which would be a long-term solution to minority participation in clinical trials. Well, my first guest this year was a company that's really fascinating. They moved to the Illinois Medical District about a year and a half ago. It's called Invenio Clinical Trials. And what they've done is they've kind of been a disruptor in clinical trials because they use a mobile telehealth truck to do them. So imagine a bus that essentially you can get vitals taken, do telehealth, whatever. And there has always been a little glitch for a lot of people to participate in a clinical trial. So let's say it's hard for you to get off work, or if you are taking care of your children, your grandchildren, or you have transportation problems. So you can participate in a clinical trial and say, okay, you need to have these tests run the third Thursday of the month at noon. The truck will be there to do it with a clinician. It is their national, and it's just a really groundbreaking way to conduct a clinical trial. So we actually did a Zoom, and it was just really interesting just to see, how they work, what they think they can do. They're even doing health screening, health testing on the south side to just kind of familiarize them, to get people in communities in Chicago familiar with who they are. That was one. So another guest that I had, this was really kind of focused on the migrant crisis that really kind of took over the news in Chicago. And so I was at this meeting with Westside United, actually. And I met this person from New Life Centers. Now, New Life has been around for about 15 years. And they had this original purpose of, it's actually church-based. And so they would set up community hubs near their churches to help combat gang violence, young mothers, children in need, dealing with the justice system. But they took it upon themselves as they saw this migrant crisis because one of their key locations is in Little Village. And so they created this new program called New Vecinos, and it was a new beginnings. And what they were doing is that they were actually at the landing sites for the migrants, and they were helping them to navigate how to get housing, get into an apartment, support services that were available. And it was great to talk to Andre Ordia, who runs this, because he helped clear up just a lot of misconceptions about how resources were being used to assist in migrant care in Chicago. So those were two of mine. I'll go back, but tell about some of yours.
Sure. I mean, even just dovetailing on that, some of the challenges for migrants is housing. And earlier this year, we talked to Mark Mulrow at Safe Haven during the time, if everyone can recall, the local election that happened this year, not just the national election. And when we all voted on a referendum to tax the real estate tax that did not pass to expand on housing for a lot of different reasons. But, I think that we're still going to experience some challenges and opportunities in the continuum of housing, especially as it intersects with the role of behavioral health. In 2025, we can already see the health information exchange, the tremendous work of Cook County and their behavioral health initiative. So we expect to see more to come with that. But, on the ground work from Safe Haven and other housing organizations is so critical to this issue. Dovetailing on that, we also spoke to Montrose Behavioral Health. We have such a spectrum of things that we can cover in the behavioral health continuum. And, as we focused on post-traumatic stress disorder awareness in June, we really talked about some of the very deep crisis intervention that they offer at Montrose Behavioral Health. And I think, it's a lot of tremendous work happening there. And also kind of in that vein, we also spoke later during Recovery Month to Chicago Recovering Communities Coalition and their, continued work to expand upon destigmatizing, supporting people in recovery. We all know that the opioid crisis has not gone away. I'm really pleased to see that on a national scale, we are seeing less deaths due to this crisis, but there's such a still an opportunity and a goal, especially with Dora and her team at Chicago Recovering Communities Coalition to really be there for people as a warm handoff when they need it. To our friends, family, and others that experience any sort of substance abuse, to really have those resources in place is really important. So those are a couple of others, and I'm happy to share some others, but I'll kick it back over to you so we can each take a little break.
Okay. Well, at my core, I'm a government relations person. So I interviewed State Rep Kelly Cassidy, who is also my state rep. She's fantastic. And she kind of gave us an overview of what happened in Springfield in the budget session as related to public health. And it really kind of dovetailed into what was getting ready to happen. And things are going to be different. And it goes back to federal money. In March of 2021, President Biden signed the American Recovery Act, and that provided $1.9 trillion for various activities to help us deal with the pandemic. Well, the state of Illinois received $8.9 billion. And actually Chicago got their money directly. So imagine your normal budget is around $50 billion and you get an additional 8.9, almost $9 billion. And now it's almost over. All that money has to be allocated by the end of this month, December 31st, 2024. And it all has to be spent by December 31st, 2026. So now, the last couple of years, we've had the General Assembly has been able to run programs actually run their dream programs. Things that use it. I wish we could do this in mental health. I wish we could do that. Well, it's over. The state of Illinois is actually projected to have a $3.2 billion deficit. And she pointed out something to me that was really interesting. She said, and I knew this because all the news with the former Speaker of the House, Mike Madigan, who presided over the Illinois State General Assembly longer than anyone had in any other state ever. 1/3 of the members of the House right now never served under Madigan. They've never had to deal with a tough budget. It was always, well, I want to do this. All right, I want to do that. This is going to be the budget of no. No, you can't. No, and no, the state is already preparing to see what budgets look like that have a 10% reduction. Although if you look at $51 billion, 3.2 is like 6% cut. So it's not lethal. The city of Chicago is going through the exact same thing. The city of Chicago has a budget of $16 billion. Chicago received $1.9 billion in American Recovery Act funds. Well, Chicago has a $1 billion deficit that they're looking at. It's going to grow even more, and that isn't even really looking at additional things for Chicago Public Schools, like the need for more nurses in school. Well, where's the money going to come from? So there's going to be some very, very hard decisions that will be made right now in the city, and then this spring in Springfield. And there's one more person. I did two more shows, but one that I thought was really fascinating person. His name's Carol Sharp. Carol is the new president and CEO of just one of the organization I'm proud to work with through the Illinois Association of Free and Charitable. She runs the night ministry, and a lot of people think of the night ministry as homeless assistance, but they're also really kind of in the vanguard of being a mobile health clinic. And so they were very instrumental in traditional homelessness, but also the migrant crisis, because they were actually getting on L trains and doing health screenings and providing support services. And then and Carol's new. I think she's been on board for like maybe 8 months. So it was really interesting to see like what her vision was, especially as she got kind of thrown into this. You know, we were getting out of the pandemic, and then like, oh, by the way, we're going to have these thousands of migrants come to Chicago at the same time who are going to be homeless. Well, we're also dealing with our traditional homeless population. So what she's doing, what her team are doing, was just fantastic work. And then to hear, actually, I almost want to say, if you go look at our YouTube reels, find the interview with Carol Sharp, because her personal story could just be a movie. What she's overcome and what she's accomplished is just really it's just inspiring. So I'm going to hand it back to you.
Yeah, I mean, speaking of people overcoming anything and inspiring stories, we talked to Access Living during Disability Employment Awareness Month, and we talked about the person I talked to and their tremendous work enablement in sports, and as well as how we do that in the workplace. So lots of things on that continuum as we think about, you know, supporting people in their roles in the workplace, but then how are we alleviating stress or inopportunities across a continuum of activities. And then also we talked to the Chicago Women's Health Center, so another free and charitable clinic. You know, the safety net under the safety net is a real issue that we have to continue to fund and support. You know, the night ministry, Chicago Women's Health Center, several others, you know, over 40 across the state are doing different, very specific things to help enhance the ecosystem. So, you know, Chicago Women's Health Center is offering lots of programming, especially for gender affirming care, and things that are very scary right now during this political shift. You know, I think they remain a safe haven for people that identify as female, and the continuum of that, and supporting people in their health care and social needs. And then last but not least, it was such a delight to speak to Sharing Notes, to learn more from Katie and the work that they are doing to bring a little joy, especially during this holiday season. It's a good reminder to bring some of the opportunities that we have is being human to human. And so bringing music into hospitals to people that are being cared for, such a critical opportunity. And I'll give them a shout out. They are having their Christmas fundraiser in Lincoln Park at an Irish bar. So if you go to Sharing Notes website, I'm sure you can learn more about what they're doing for the holidays.
Yeah, my last show that I did, well, I worked with HC3, Meghan a lot. Then the group I work with, probably the second most, probably even more, is the Illinois Medical District. So I interviewed Allison Hanson, the president and executive director of the IMD, and well, CAN TV is in the IMD, where my office is located is in the IMD, and it kind of goes, they're involved in a lot of the initiatives that Foxglove is involved in. But then we actually chatted about, and this is going to be really, we're going to be really active, the Foxglove Alliance, in innovation. Chicago, right before our eyes, is becoming this life sciences innovation global hub. And it's sort of the convergence of economic development, workforce development, and med tech. And I know that we're going to try to look at some problems that, good problems that are coming down the road. Like, we're going to need thousands of people to fill jobs in life sciences clinical work that will pay very well, many that do not require a 4-year degree. So we're looking at, if you, young person in Chicago, 17, 18, if you would like to have a career that will be fulfilling, that you can truly raise a family on, that will have growth, and would go to community college and then just get 2 or 3 certifications, you'll be hired, and there will be huge demand for your skills. But what we're looking at is our job will be to get the word out, to figure out a way to connect the life sciences companies, innovators, with young people, the same way that we're doing, our partners are doing with youth pathways for careers in healthcare. It's just going to be, it's going to be our version of Silicon Valley. They said, well, Chicago's not a tech hub. It's like, well, no, it's going to be it is a life sciences med tech hub. And so that was like my last show of the year, and it was great. I'm looking forward to next year. There's going to be more related to M3R activities in the innovation initiative, and it will be interesting to see what happens in Washington. I'll just leave it at that.
Yeah, I think there's a lot of unknowns, opportunities, challenges. I don't think that the political climate will not dictate some of the things that happen next. But I think that there's a lot of opportunities for us on the ground here with all of the organizations we mentioned doing critical work with our organizations helping to contribute to those as well. I don't know how much time we have left.
Takora wanted me to mention 3 things I almost forgot.
Yeah.
One, they're going to be very active with the work for the Academy of Medical and Surgical Nurses. We're going to get them involved in some of the youth pathways work that Foxglove is doing. And also, Hectome has this nurse essay competition through the Hectome International Medical Humanities Journal. Well, guess who the judges are going to be? The nurses in the humanities. And they're also working on a fundraiser for the COVID Memorial Monument that will be in the IMD. So I've worked with them some in the past, but I'm going to work with them a lot in 2025, and I'm looking forward to it.
I mean, what other, aside from political powers, what early rumblings are you thinking about or concerned or curious or excited about for 2025?
Well, it's going to be interesting because the best way to describe what's going to happen in the General Assembly and with Governor Pritzker, they are trying to build a firewall so that if there's anything coming out of Washington that doesn't really mesh with sort of like the philosophy of how Illinois operates, whether that could be with abortion, or we're even having our own health exchange. That would be a version to possibly, well, we don't know what's going to happen to the Obamacare, the ACA, but Illinois is going to have its own version of an exchange. So that's what's going to be going on in Springfield in healthcare, and it's a lot of work, especially with reduced financial means, and probably a lot when we have shots at getting competitive grants. There'll probably be less for Illinois for reasons that shouldn't matter, but they probably will. So it's going to be a it'll be a rough patch, but they're pretty confident that. I remember when I talked to Representative Cassidy, she was very confident that, you know what, they're just going to get serious, really prioritize, and it was sort of like they know that money at that level will not come back again.
Yeah.
But they were able to make what they consider to be longer term investments so that, you know what, let's not focus on one shot programs. Let's figure out ways to invest in programming or to build infrastructure that will be available for the long term. And I think they did that. And we will see. The city of Chicago will be very interesting because they're going through some budget problems that are going to be that have been put off for a long time. That everything's just come to roost right now. So we will see.
Yeah. So we will remain to keep you apprised, watch and observe together as we navigate both at the city, the state, the national level, but most of all, it's because of our neighbors, our friends, our communities that allow us to thrive. So as long as we all continue to march towards these goals, that together we can build a healthier Chicago, I think we're all on the right track. So I want to thank Nonprofit Services at CanTV for being our incredible partner throughout this year, always having our back with the production of these episodes. And for all of you for tuning into Community Pulse, which airs on CanTV Channel 21 and is available to stream on their website, cantv.org. Wishing you all a very happy and healthy holiday season. We are grateful to each of you. You stay well, Chicago.